Good evening. Can everyone hear me? Thank you for joining us. My name is Francine Marie. I'm Public Affairs Director with Beasley Media Group and the host of the Francine Marie Show, which airs on 6 radio stations. Did you know that April is National Minority Health Month? And I'm honored and excited to be your host tonight for the virtual town hall, which is made possible by We Can Do This campaign, Heart and Soul Magazine, and CMR Ignite. So we've designed this event. It's going to be interactive. Are you ready to have some fun? Are you ready to share your questions and your concerns? Well, this is what it's all about when it comes to mental health. So drop your questions and your comments in the chat and your experiences with COVID-19. So here's the deal. Tonight is going to be a safe space. Yes, it is, for lived experiences. So we're just going to let it be free. We're going to have some fun. And at this point, I've got a surprise for you. I've got this TV ad. You might have seen it, not sure, but it's going to be pretty exciting for you to see because this event has had a reach on radio, TV. And the name of this campaign is We Can Do This campaign. It's tailored toward more so at-risk groups. So the messages are consistent, they're fact-based, and this is a time for us to just be open. In addition, I want to acknowledge and celebrate our amazing media partner. It is Heart and Soul Magazine. Yes, Heart and Soul Magazine has been a trusted source for us since 1993, and their digital platform and print magazine speaks to us. Yes, it does. So thank you, Heart and Soul team, for your continued support. So what have you been feeling lately? Well, you can check us out at you can check Heart and Soul out at heartandsoul.com. But they've covered many stories about isolation, loneliness, the milestones we've missed. I know we all have. Increased anxiety. Can somebody raise their hand? Can somebody raise their hand in the chat? We've all had this heightened level. And tonight we're going to ease it for us when it comes to our mind, body, and spirit. So let us all take a deep breath, right? It's been a minute since we took a deep breath. Parents, I see you. You have children and you've had to do the virtual schooling. And some of us aren't really good school teachers, but we have made it through this. We've had to make tough decisions about vaccinating our children against the virus. So with that said, let's take a look at the commercial I talked about earlier. I was so excited about it because it's Dr. Nina Ford Johnson. And this has been on TV. You might have heard it on the radio. So this commercial focuses on the important decision that parents have to make when it comes to their children. Let's take a look.
When I became a mother, it was almost like all the other titles mattered a lot less. I may be Dr. Nina Ford Johnson, but I'm a mom first. My babies are my top priority, always. With COVID going around affecting Black kids at a higher rate, I'm telling any parent with kids 5 years and older, mine will be getting the COVID vaccine as soon as they're old enough. The risk from COVID far outweigh any risk from side effects of the vaccine. It's the best protection for my kids and for yours.
So I'm a mom first. I love it. I love commercials that focus toward moms, focus toward parents. So you might have seen that on BET, TV One, commercials. But I want to introduce you to my new best friend. Yes, he is. It is DJ Wild Wayne. He's an on-air personality too on Q92.3 FM radio in New Orleans. Now, he's going to share his COVID-19 story, how it impacted him, and we want to hear from you too. So ladies and gentlemen, clap it up for my new best friend, DJ Wild Wayne.
Good day to all. It's Wild Wayne from Q93 in New Orleans. I work with iHeartMedia. I do afternoon drive, 2 to 7 p.m. on the #1 radio show in the city. Additionally, I do voiceover work with NBA 2K. And I also work with the NBA's New Orleans Pelicans. I'm a PA announcer. And that's the reason why I couldn't be with you guys today on Zoom, because we're in the playoffs trying to beat up on the Suns, and I'm courtside right now. In the real world. All right, today's topic is the effects of COVID with mental health. And I think it's very important that these conversations are had not just on this Zoom, but across the country, because people of color, blacks and browns in this nation, died at a higher proportion than whites, period. And this is a domino effect, not just the deaths of patriarchs or matriarchs or the heads of household, the heads of families, but the trauma associated with it. We were already in a position where our deaths were through the roof because of COVID based upon underlying conditions like diabetes, which is very prevalent in New Orleans, hypertension, very prevalent in New Orleans, obesity, heart disease. This just exacerbated the amount of deaths that happen. Now you have broken families. This is a traumatic experience. And like I said, the effects will be long-term in people of color's communities across the country. Will these things be addressed? Probably not. You know, we're in a city that had lots of PTSD following Katrina and other natural disasters that have happened. I think this is going to be kind of the same thing because it was never addressed. There were never widespread studies on the trauma involved from these huge events, and the pandemic is going to be one of those things. Additionally, when it comes to the mental health aspect, it hits close to home because I have a sister that's bipolar. So I've been able to see the effects firsthand. A lot of the programs and resources either diminished or were cut out completely. And these folks that already were dealing with mental health issues now are definitely dealing with it at a much higher level. These are things that we have to consider when it comes to the effects on mental health of our communities. Additionally, the rate of unemployment, you know, the amount of folks without a job, these stimulus checks were given out. And now at this point, a lot of these businesses or jobs that folks had are gone. There's no more stimulus, no employment. This takes an even greater toll on our communities. And this is all, like I said, as an after effect of COVID. I think the fact that we had so many deaths because of the underlying conditions, and additionally, how many folks were anti-vaccine, really magnified and multiplied the amount of deaths that we had. And like I said, it's a domino effect. I would hope and pray that the powers that be, especially when it comes to our medical and also our behavioral health people, address these topics. I mentioned earlier about the after effects of Katrina and the community here. Now, you know, 15 years later, post-Katrina, we are seeing the effects that it had on our youth and families because a lot of them are lashing out. A lot of these youth are committing crimes or suicidal, and these are things that probably could have addressed if some of these large amounts of funding that were allocated from the top went to the places that they needed to go in our communities. So I'll leave it at that. We have to make sure and be proactive on getting mental health addressed as the after effects of COVID. We also still need to continue to push getting vaccinations. We're not quite out of the woods on COVID, and the boosters as well. That's my 2 cents. It's Wild Wayne.
We love it, Wayne. You know, to be so honest about how it's affected us, how COVID has affected us. He was transparent. He was telling it like it is, as they say. When you think about the impact of being separated from family and friends, the grief resulting from loved ones that we've lost to this virus, and then the stress, like I said, of teaching our kids at home virtually and us as parents working home virtually. So it's important to talk about this in a very safe place. And tonight, that's it. So without further ado, I have got to introduce you to our outstanding panel of medical experts. I'd like to have each of them tell you who they are, where they are. Let's start with our amazing Dr. Samara Brown. Hi, Doc.
Hi, how are you? Thank you so much. Good evening, everyone. I am Dr. Samira Brown. I am a primary care pediatrician. I'm practicing in Atlanta. So I see babies from the first day that they're born all the way through adolescence. I absolutely love what I do. I'm also the co-founder of Little Lives PPE. And of course, I am a proud alum of Xavier University of Louisiana. So, shout out to New Orleans as well. And I also graduated from Harvard Medical School, and I've been practicing for over 10 years, so lots of experience. And I'm just so grateful to have the opportunity to be here to speak about mental health, which is certainly near and dear to me.
Oh, thank you so much. And I always say this, you have the best voice ever, right? Because you have to have that demeanor with kids and parents. I love it. Thank you so much. Hello, Dr. Byron Jasper. How are
Hey,
you?
hey, I'm doing well. Thanks for asking. Good evening, everyone. I'm Dr. Byron Jasper. I am a primary care physician, family medicine trained, currently in Baton Rouge, Louisiana, but I also do some work in New Orleans as well. Like Dr. Brown, I'm a proud graduate of Xavier University. For undergrad, I did my medical school and master's degree at Tulane University, also in New Orleans, and did 2 fellowships in the Washington, D.C. area, one at Georgetown and one at Providence Hospital, focusing on public health and also focusing on HIV and hepatitis C. Currently, I am the founder and owner of the first direct primary care practice that is Black owned in the state of Louisiana. And we're proud to slowly but surely be growing and giving care to all the people who are underserved, who may not have insurance, who may have insurance, and those that just need a place to call home for primary care. So I'm happy to be here and can't wait to have a great discussion.
Thank you so much. Awesome. So now I have to introduce you to our other best friend. It's Dr. Kendall Jasper. Hi, Doc.
Hello, how are you all? Good evening, everyone. As Francine stated, my name is Dr. Kendall Jasper. I'm a licensed clinical psychologist, currently practicing in 3 different states, North Carolina, South Carolina, and the state of Louisiana, providing more of a comprehensive community mental health type of practice that was born out of my private practice that I started 18 years ago. It seems like yesterday. So I'm very pleased to be here. Thank you for allowing us to be on this platform and talk about this very important issue.
Thank you so much. You know, I have to ask, this is not in the script. Are the Jaspers related?
We haven't figured that out yet, but I'm quite sure we're gonna figure it out. Absolutely.
You know, tonight is all about connection, so this is good. And the hot topic of mental health right now is so in our community. You know, we miss our beautiful Miss USA, Chesley Christ. You know, we've had a lot of things in the news that we've seen, and we just want some help. And I'm glad you're here to relieve us. So let's be honest. Tonight in the chat, just put what you need to ask there, and we will field those questions to our medical experts today. So healthy conversations that we're going to have tonight. Number one, I'd love to start with Dr. Samira Brown. The pandemic has been tough on everyone. We all know that, but we have literally been on a roller coaster, right? Because you couldn't have explained to us 3 years ago what we'd have going through for 2 years. The shutdown, you know, we've never been in a place where the whole world shut down. Our family members getting sick, forced to wear masks. How about isolation? So from your perspective as a physician, why do you think the pandemic has had such a big impact on our mental health in the Black community?
You know, that's a great, question and a good place to start. We really looked at, especially, as a pediatrician, we already knew that for the past 10 years, children have been experiencing higher rates of anxiety and depression. That was pre-pandemic, right? And then you look within our community, and though our rates of mental health oftentimes are the same or very similar to the general population, we're less likely to actually receive care for mental health, right? And then we also are more at risk for having inequities in the social determinants, right, of our health. So I think it's a, compounded reason in terms of why the pandemic has worsened, really all the things that were already there. And certainly there are so many things that you're talking about that even though you may not have been affected physically, certainly almost everyone has been touched mentally, right, by the effects of COVID. And one of the huge pieces that we're facing here in pediatrics is the staggering number of Black children who have lost a primary caretaker, whether it's a parent or a grandparent. We certainly know that 1 in 5 households here in the US are multi-generational. So there's so many effects that even if it isn't that person themselves, but there's so many other, effects that COVID has had on our Black community. So that's why it's really important and why we're here today to really focus on our community in ways that we can help.
Thank you so much for that. I appreciate it. Dr. Byron, do you want to chime in on that one? We've been faced with so many challenges. I know is it different for men and women?
Yeah, I mean, I'd say always. That's a really easy question in the sense that no two people are the same. No two healthcare strategies should be the same. Different communities, different ways to impact the community. I think the idea is that we often feel like Black and brown people may be monolithic, meaning we all look the same, we talk the same, we have the same habits, and that's just not the case. If you know us individually, you know us individually, and very rarely will you see us in the same way in every single day of our lives. So to kind of put it together, I think one of the issues of mental health in the community, specifically related to the pandemic, comes from people just not being in care on a regular basis. We often focus on sick care in America and not necessarily on primary or preventative care. And I'm a huge advocate for trying to get people into care before they have an illness, before they have an ailment, before they have a mental health break. So the goal for me is often to advocate for people to seek out care before you have a problem, rather than when you have a problem.
Oh my goodness, that's so true. I was just envisioning, right? We feel a certain way. We need to pick up the phone or research. All right, Dr. Kendall Jasper, let's chime in on that one.
Well, I mean, on the heels of what my brother, Dr. Jasper, stated, I think that, it's systemic that lends itself to our philosophy. Quite honestly, I think that our systemic issues in our community lends itself to the philosophy that we just don't do a very good job of seeking out preventative care prior to there being an issue. Some of that is about the resources that exist. Some of it is about the presence of, I would say, paranoia, hysteria, and concerns about dealing with institutions that have not been very good to the Black community, since our time being these United States. And I think that as a function of that, we find ourselves in most situations on the lowest end of the statistical category when it comes to health and wellness. In particular, if you're looking at mental health and wellness, we're now starting to see a revolution of Black folks being able to openly state, hey, it's okay to go get treatment. It's okay to seek treatment. And then what we're going to deal with is the demand not necessarily meeting the supply, right? An inability for us at this time to meet the demand of so many Black folks wanting to seek out mental health treatment and how we address that. So that then also becomes a systemic issue, and the need for us to have more individuals in droves find themselves in the medical and mental health field.
That is key at the end of the day, right, Dr. Kendall? Yes, thank you for that. Yeah, I definitely want Dr. Kendall Jasper, he just said something really tying into my question number 2, Dr. Brown. We can be, right, a therapist to our child to a certain extent, to a certain age. But then it gets to be, when do we say, I'm not going to be able to maybe address it fully with our child? Should our child find someone for our child to talk to?
Yeah, that's a great, question, because I think we always want to make sure that, you have the support that you need within your community, right? However your family looks, right? That children know that they can come to you. They are free to tell you how they feel. They know that it's okay to feel any way, right? And that we want to help them learn how to manage that in a healthy way. And parents really are their first caretakers, right? Who teach them how to manage emotions, right? How to calm down, right? From temper tantrums, those kinds of things. But then when it becomes problematic, right? When it's pervasive, when we can't function in school, when we're not able to maintain friendships, right? Whether we're, no longer interacting with the family, we just want to stay in our room all day, right? So there are a variety of ways that kids can present with mental health issues, anxiety, depression. And really the first thing you want to do as parents is ask your child, how are they feeling? And understand a lot of times they may not understand why or what it is that they're feeling, and reach out for help, whether it's a school counselor, your pediatrician, right? You really want to come to a trusted provider, and we certainly can screen for mental health, disease, and refer you. And the good news is that there are many, many treatments, but certainly, just like, Dr. Jasper was just talking about, we have to do a really good job of increasing the size and the diversity of our mental health providers, and make sure that children and families have access to it across all care settings, right? So whether it's a daycare or a school or the primary care office, that this is what we really need for our community.
Access, 24/7 access. That's what we need. That's what we need. Oh, checking the chat. So how do you feel as a medical professional? The Public Health Emergency Fund recently announced that the PHE, which pays for vaccines, will end in July. Do you want to chime in on that, Dr. Byron?
I mean, I'm not as, I guess I'm a little more do for yourself what you need to do as opposed to waiting for others to do it for you. I'm more of a self-starter than some people. I advocate for my patients to get vaccines all the time. Some of them don't like that I advocate for them to get vaccines, to the point where they hit me with the, oh Lord, he goes again. And I'm like, you was gonna come in here and you were gonna get it. So you might as well just go ahead and pull up a chair and listen in. So the goal for me is to be my authentic self with them so they can actually be their authentic selves with me. And for this conversation, the funding being there is helpful, but it's not the only way to get a vaccine. It's not the only way that you will ever have access. And if you have and I'll come back to it, primary care professional in your life, they will hopefully help you navigate how to get access to those vaccines, how to get access to the mental health professionals, how to get access to any of the services you need from a healthcare standpoint. But oftentimes, again, we wait until something is wrong to say, you know what, how do I do this? So the funding is gone. Now I can't afford the vaccine, so I guess I don't need it, which is completely backwards. We would rather you get it on your own, but we are still here. We're going to advocate for you. We're going to help you get access. Myself and Dr. Brown being on the primary care side, we're going to probably be, there after hours doing whatever we can to get you access. And then Dr. Jasper is going to be there to counsel you through all of the things that you may be worried about when it comes to the stress and the anxiety of a vaccine. So all of that being said, I think it's really something to note, but I don't think it's going to change much. We can do it. We can do it on our own. And if we don't need to do it by ourselves, then let's have people help us get to that point.
Thank you for that. Thank you for that. Right. Be proactive instead of reactive. We're still learning our lesson, Doc. We're still learning. Dr. Kendall Jasper, Dr. Byron just said it. And that's our third question. Culturally competent care. We're still looking for it, Doc. Give us some advice on how to find it, because they don't make yellow pages anymore. I guess they do, but it's just finding someone.
Well, I think that, I always advise people to, to a certain degree, we're in the customer service business, right? We treat patients, but we're in the customer service business. And I think that individuals need to understand that they may go see someone, they don't feel like it's a good fit. It's okay to seek out, someone else who may be a good fit. Now, you have to be careful about why you feel like that person isn't a good fit, of course. it can't be because someone is challenging you. It can't be because someone is advising you to take better care of yourself, and impressing upon you the importance of doing so in that process. And sometimes experiencing a level of discomfort in a room with your doc is okay based on where that's originating. But you also have to feel like there is some form of a rapport relationship with that individual. A lot of what I do and what we do is about being able to build a strong relationship with you and you feeling comfortable, as Dr. Jasper said, about being your authentic self. I'm going to be my authentic self so you can be your authentic self, and we can have a natural and organic, sometimes spirited conversation. And if we leave out of that with you feeling somewhat frustrated at times, it's okay. But at the very beginning of a process, I like to explain to patients, hey, look, I'm not here to be your friend. And there are going to be times when we're going to have some difficult conversations. And I need for you to understand that this is not being done with any form of malicious intent. This is about your treatment and understanding that at times you need to walk away from this, understanding that I'm not saying this because I don't have a level of care of concern, but I'm here to be, I'm here to tell you the truth. I'm here to maybe push you to do some things that are uncomfortable, but out of that discomfort, there may be a level of growth that you didn't see before. So I think that part of that cultural competence piece is about being able to have that conversation. And then you walk away from it not feeling like, hey, he just said that because we have some significant cultural differences, or he or she doesn't understand me. And I think that that's where the relevance of culture becomes even more important.
Thank you, Dr. Kendall. Yes. Dr. Brown, let's pick up on what Dr. Kendall just said when it comes to being open and honest with our kids, because they've been isolated. And I'm not sure when kids start off playing video games. I'm not sure, but they love I've seen babies with electronic devices, Doc.
Listen, we see infants who are, able to scroll up.
And when we, should we let them just run free on the internet? I mean, we have to put some safeguards up, but that's been the pandemic impacted that. Now they're on it more because they were on it for 2 years?
Yeah, and we know that social media, can definitely put you more at risk for things like anxiety and depression when it comes to children. So there definitely need to be limits for children. Under 2, we actually don't recommend any screen time at all for children, right? You want them to be playing, having live conversations, maybe very limited FaceTime video chats, right, with folks who are not present. But really you want to sing and talk and read and play games and engage, right, with kids at that age. And then certainly after that, very limited, screen time. So certainly when it comes to internet access, you definitely want to make sure that you have parental controls on, that you're monitoring what's happening, that you know who your kids are playing games with, because there are predators who are out there who can get online with your children and, pretend that they're someone their age and find out information about them. And so you want to make sure that you are being very vigilant when it comes to what your kids are being exposed to, even the messages that they're receiving, commercials, those kinds of things on TV. So certainly if they do have access, when they do and you limit it, try to make it commercial free, and also try to sit and watch with them to give them some context so you can have conversations about what they're seeing, whether something was appropriate that happened, or is it too violent, right, for their age. So I would definitely be very proactive with what children are seeing, and please be mindful that certainly it does increase their risk of mental illness.
Thank you for that. Dr. Byron, do you want to chime in on that?
Yeah, I think obviously, hearing it from the amazing background of a pediatrician is always going to trump anything more than likely that anyone else will say about children. I'm family medicine. I know I can take care of kids, but pediatricians can blow me out of the water when it comes to that. So I think everything she said is on point. I completely agree. only thing I would add is that having those conversations with children when they are in essence not happy are going to be probably some of the best conversations you can have, where you're literally having that authentic conversation about what you're feeling is not necessarily a bad thing. It may not be something we are quite understanding of what it means to have these negative experiences, negative feelings when I'm telling you no, or I'm telling you this is something you can't do. But when you do that early on, it gives them the platform to open up to negative feelings, right? I've had the pleasure of taking care of kids as young as 2 years old and 3 years old. And a lot of times the kids get really upset. And historically in the African-American world, we would see people reprimand the kids for acting out, right? My favorite story goes back to when you take them to the grocery store, and if they act out in the grocery store, it is literally the "you're gonna get it when we get home" kind of conversation. But I've seen in times as we get further along, we have conversations in a way to explain why this is not okay. Let's have a conversation about it. And then if we do that early on, when a kid starts to have those negative reactions, they're more likely to come to the parent and say, I don't know what's wrong. I'm feeling negatively. I'd like to talk to somebody, rather than I can't talk to my parents, they won't understand. So if they can't talk to their parents, they're talking to their friends, and then they start doing things behind your back, and it's a whole nother conversation. So I think the idea is to get them early is what I'm trying to say in a very long-winded way. It's very much me saying, if we do this and we do it right, you build the foundation, and that foundation starts to get bigger and better, but you have to get it early and not be afraid to do something different than what you were told and what you were taught so many generations ago.
Oh, Dr. Byron, I was thinking about, my parents used to yank the phone out of the wall, right? Those are the old days. We can't do that anymore. Well, we can, but Dr. Kendall Jasper, do you want to chime in on that one? I know, what do we say to our kids?
Well, I think number one, we can't be afraid to parent, right? And I think that, there are times when, and that's not to indict anybody. I think that we and Dr. Byron Jasper hit on it. I think that we lose sight of some of the lessons that we were taught as children, as if those aren't effective in this new age of technology. And that's not accurate at all. Setting limits, setting boundaries, having clear understandings of what the rewards or consequences are for behavior lends itself to children being able to navigate a space very clearly and understanding that, okay, I will get positively reinforced for engaging in this type of behavior, and I will receive some form of, I wouldn't say punishment, but some form of consequence that I'm not happy with if this is the type of behavior that I engage in. And sometimes it's about the patience of the parent more so than it is the child. If you go back to the example, a lot of times it's about parents not having some form of lack of patience with public embarrassment, as opposed to saying, hey, listen, if you want to fall out on the floor and have at it, it's no indictment on me, but when you do calm down and you relax, we can have a conversation about what's transpiring, and I'm going to give you all of the wonderful attention that you're looking for, right? Because you're just looking for some form of attention anyway in that moment. Now, I hear my mother and father in the background saying, listen, this is a new age parent, because my mom and dad are like, listen, bro, you better get off the floor, get your behind in the car, or we're going to have some problems. But times have changed, things are different. And we also understand that there's more than one way to manage a situation. Not that our parents were wrong, but not that this way of managing things is wrong as well.
I'm so glad you mentioned that, right? Our parents, right? You can do that if you want to, but letting them know, Dr. Brown, that we love them and you can have some really good attention from me. When you act good, I act good. I don't know if we should say that, but I had someone in the chat said, I'm very concerned about my child. They haven't been the same since COVID, and I believe they may be suffering from some mental health issues. Ooh, Dr. Brown.
It's great that you're here tonight, that you're asking this question, right? And you do. I would highly recommend that if you haven't had a conversation, with your child yet, really, reach out to them and just open that line of communication and understand that they may not, want to talk about it in that moment, and just let them know that, when they're ready, you're ready. Certainly, you don't want to ignore this, right? So just like Dr. Jasper was saying earlier, you don't want to wait till it's an emergency. And lots of kids can then engage with you and talk about how they're feeling, right? And come into your pediatrician, get screened, right? And get your referrals, make that appointment, establish therapy, right? It doesn't mean that your child is going to be on medicine. It doesn't mean that your child is going to be hospitalized, but coming in, establishing, getting those screenings is how we, prevent those mental health emergencies. And there are so many other children that are feeling the same way. So a lot of times too, there can be groups, even their school counselor, their teachers, sometimes their friends, right? Are going to be resources about how, your child is acting. So definitely talk to them. Don't wait. Start today.
Don't wait, start today. I love that. And not being embarrassed, because it's the stigma too. Oh, okay, Dr. Byron. Let's get real serious, because sometimes we don't even want to tell our kids that we have a therapist. Should we be that open and honest?
Yes, I could say that. If I sounded excited about that, that means that we are making progress. I mean, it is very baffling to me that when I tell people you have anxiety, they look at me as if I have just smacked them in the head or something like that. And it's one of those things of, it's okay to say you have this mental illness, because it's an illness. It's not a scar. It's not something that is to be frowned upon. It is something that you don't necessarily want to have, but it happens. I don't have anyone walk in and say, look, I got diabetes, but don't tell nobody, because, they're going to look at me funny. Or, I have allergies, and, if they know, they're going to look at me funny. So for some reason, when we say you have depression, people almost clutch their pearls and sit back like, I'm not crazy. And that automatically puts you into the negative mindset. So yes, parents should obviously tell their children what is going on with them. I grew up in a household where parents didn't talk about their health. We found out something was wrong when they were in the hospital. And yes, I am a physician. So let that sink in. You have a doctor in the house, but you don't want to talk about your health. You have someone in your family who is in the medical field, but you don't want to talk about your health. So let alone mental health. I think, honestly, the more transparent you can be with children about what's going on with you, the more they will be transparent about what's going on with them. And there's no two ways to slice it. It's really, you give and you receive. And I believe that when parents are telling their children, I have depression, I'm struggling with it, I have good days, I have bad days, there are days where I'm not feeling so hot, and it may seem like something's wrong with me, and it almost seems like I'm treating you a certain way, but it's not on purpose. And then when a kid sees that that is happening, they may start to understand that, I feel the same way. I didn't know what it was called, and now that I know what it is, I'm more likely to seek help. I'm more likely to go see Dr. Brown and Dr. Jasper to figure out what this is. And if we do it in the right way, it starts to be a natural progression where more people are in care, more of the healthcare disparities get eliminated, because we're not, again, waiting until we're in the hospital on death's door saying, I woulda, shoulda, coulda. It's more so we've been in care, we're doing this proactively, and then we can obviously get these things treated before they get really bad.
Oh, thank you for that. Dr. Kendall Jasper, I do want to field one of the questions to you, or maybe a couple of docs. Now that we're 2 years into COVID, some of our Black Americans are tuning out messages. We're kind of going like this, Doc, because we're a little confused, but we're not confused. But what's the truth? And that's why I'm glad tonight is open conversation.
Mm-hmm. Well, I mean, it's become more of a political misinformation campaign, unfortunately. And I think that sometimes you can, it becomes somewhat confusing, and you can sort of get sort of a glazed, sort of a hazy look in your eyes because there's just so much information and you don't know what's a trusted source and what isn't. You know, and again, in our community, word of mouth, like we will, you know, someone will tell you something and then it's like the game of telephone. And before you know it, as long as it comes from my homeboy, it has to be true, like, because he said it, right? Or because a celebrity or celebrity type or an athlete said it, it has to be true. And that's how our community works. Unfortunately, and sometimes the trusted source in the room, the three docs that are on this call are drowned out by someone else who is more famous or more recognizable, unfortunately. And I think that we have to do a better job with our messaging and understanding that part of that process is being on the front line, being someone who's tangible, who you can see and say, hey, listen, I understand that, you know, Jamal told you that this is how you address this, right? Like all you need is some Robitussin and ginger ale and you'll be okay. No, that is not how this works, okay? That is not how it works, right? You need to see someone and you need to be able to sit in front of someone who has been educated, who has had years upon years of treating individuals just like you, although your issues aren't the same, to be able to find a pathway for you to find some relief and address the issues that are going on, including your children, right? And what's interesting about misinformation or even your children seeing you go through a process is the idea that they are very keen and perceptive anyway, and they realize something's going on. So you engage in your own misinformation campaign in your own home by making an attempt to deceive your children and tell them, hey, listen, there's nothing really going on with me. I just had a bad day. Well, mom and dad, you've had like 35 bad days in a row, right? And we see it all over you. So you're providing us, you're setting the seed in the table for misinformation in our own home, right? In our own environment. And then we go out here and, social media, different media platforms, and you don't know who to trust, what to trust. And I think that it's important for us to be able to steer our children and our families in the right direction. This is a trusted source. Right. Over time, they've shown themselves to be in that way. And this is where we need to be getting our information from.
Exactly.
Can I say one quick thing? And I completely agree, but I like to frame it slightly different, but I agree. And I do it differently just for one reason. When it comes to medicine, we like to get advice from everybody but the medical profession. But for some reason, if we are in trouble with the law, we don't say, well, let me call my cousin to figure out how I'm going to get out of this ticket. Let me call my next door neighbor to see how I'm going to go ahead to court and fight this actual lawsuit. No. We call the lawyer immediately, sometimes 3 or 4. But when it comes to mental health and medical stuff, we call everybody but the people who have been trained and literally have went to school for decades. Okay, let that say, not years, not months, not hours, decades. We have decades of training, and people will come to me and say, well, my friend told me that this, that, or the other. And I'm looking like, what school your friend went to? None. Okay, all right, that's what I thought. So we're not going to do that. So my idea of saying it in a very eloquent but straightforward way is let the medical professionals be the medical professionals and let everyone else be themselves. And then when we do that, I think we'll get a lot further faster.
We did have another question. Thank you for that, Doc. We had another question. I'm not sure if you want to address it or not, but there's been an uptick in crime. There's been an uptick in ABC. Well, I'm in the Carolinas where we have liquor stores. They're called ABC stores. But when the pandemic hit, we were at that. It was like, what time does it open? Right? Because we're self-medicating. We're out of money. So there's a lot of crime. I don't know if you want to address that. That was in the chat. There's been an uptick of everything. Can we say that?
Yeah, I'll jump in and say, I mean, uptick in crime is a very loaded thing. If it comes to why people engage in the behavior they engage in, there's a lot of answers I'm sure we can all get to. When it comes to medical related reasoning behind why potentially crime happens, I think a lot of times people are desperate and they don't know what to do when they have certain things that are happening. You know, if you feel sick, you're going to self-medicate sometimes because you don't know that there's a medical health professional that looks like Dr. Brown or Dr. Jasper or Dr. Jasper. So, you know, in the model that I engage in my practice, we try to eliminate the need for insurance to see the doctor. So the idea is that you don't have a reason not to come see me. You have no reason or excuse not to come see Dr. Jasper. You have no reason to say, well, I can't afford, because that hopefully goes out the window, or I can't get access. So when people often are doing things that are not so positive, I think we have to look and do something that I tell patients all the time. You have to give people grace. And when you give them grace, all of a sudden you say, well, I don't really know what's going on with them, but I'm going to give them the benefit of the doubt sometimes. And sometimes when you do that, you realize people were going through a lot more than you actually know. And when you do that, it opens up the door for them to say, you know what, I need help. And offering them an opportunity to get help is a lot different. But overall, the mindset when it comes to medically induced things that are negative, I think it really and truthfully starts with access, and also starts with having people understand that we are here. We are Black. We offer care. We offer care that is far better, oftentimes 4 or 5 times better than some of the others. And I'll let you sit with who the others may be. But the idea is that when we do it well. And sooner you know where we are, the better.
Right, exactly. I'm so glad we're doing this tonight, and the chat is on fire. And we're so glad that you're here with us tonight, because we can do this. One last question about the COVID vaccine. I know that we're in 2 years into this. Moderna has asked for the FDA to approve vaccines for children 6 years old. So, Dr. Brown.
Yeah, right now, that from 5 and up, there is a COVID vaccine for everyone in the US. And if you look at just 5 to 11-year-olds, just with that Pfizer data, we have safely vaccinated 8 million children just here in the US. That's a lot of safety data. This is a safe vaccine. It's a third of the dose that adults get. Kids are doing phenomenally well with it. And so when we talk about this next group of vaccines for kids who are under 5, the first thing that has to happen is it has to get approved. All of that safety data that they did in their trial has to be looked at. So they may ask for it, but we have to see if it's actually safe. So there are a number of hurdles that they have to go to, and we set that bar extremely high for children, higher than for adults, as it should be. And certainly if it's not effective and if it's not safe, because it has to be both, then we won't be giving it approval. So I think we have to wait and see. And really, until we know for sure that it's safe and effective, we won't be giving that recommendation. But so far, the good news is that they have been able to develop vaccines quickly based on decades of research, and they have been working thus far. So certainly, if your child is 5 and up, call your pediatrician today. Go to vaccines.gov. If you need to find out where you can get a vaccine close to you. And if you haven't gotten it, certainly make sure that you get vaccinated and get boosted as well. But certainly for children 5 and up, it's safe. So please schedule your appointment today.
Awesome. Do it today. Pick up the phone. I've got a house phone here. I'm not going to pick it up because then I'll look really weird. But our last question I want to talk about before we do our next fabulous video is, what advice do you give to someone right now who can, mental illness disorders? Are there resources out there for us? Where do we look for them? And like I said, we've got about 1 minute per doc. Dr. Byron. Dr. Brown.
Yeah, I'll just say really quickly, I have used the Mental Health Alliance. They have a website, and I am drawing a blank on the URL. I think it's blackmentalhealth.com, if I'm not mistaken. And they have a lot of resources that kind of tells you what things that may be in your area, if you will. So I think that's a really good one. And I also think, again, it sounds cliche. I'll say it until I'm blue in the face. Engaging in care early. When you do that, you will find that people in the medical field have a lot of resources for you, so you don't have to do it yourself. Right? Literally letting other people help you, because that's number one, what we're paid to do. And more importantly, we have experience. So I think just engaging with the primary care you have pediatricians, family medicine, whoever, getting in care early. And then when you have a problem, asking them to help you navigate will probably be one of the easiest and biggest things to do.
Exactly. Yeah, we make a grocery list. Why can't we make a list for other things that we need in life? I definitely have to ask this because I'm a big fan of aromatherapy. I don't know if that's going to be something that we could do to kind of cool and ease some of this anxiety. Any doctor can answer that one. Or what's your favorite way?
I don't mind talking. That's something I do very well. So let me go ahead and jump in. What I do to help calm my nerves that I think is productive, and people laugh when I say this, I actually DJ. So when I was in medical school, I needed to pay bills and I didn't have the time to study and go to a 9 to 5. So I actually love music. I love music to the point where I love listening at all times. And I literally always had the affinity for playing instruments. So I say, well, you know what? Let me go ahead and give it a try. So I bought 2 turntables and a mixer, and I taught myself how to DJ, and I've been DJing ever since. So finding healthy behaviors, right? You don't have to always do what, my friends drink, so I'm gonna drink. My friends do negative behavior, so I'm gonna do that. It's finding what works for you. Some people it's reading, some people it's exercise, some people it is yoga, aromatherapy, things of that. So there's nothing wrong with finding something healthy, and it might be different, right? You don't have to do what everybody else does. And I think that actually makes you more unique. And for me, DJing is the thing that I do. So spinning for 3 or 4 hours and not realizing it's 3 or 4 hours, to the point where my family and friends are like, hey, what are you doing? I'm like, well, I'm spinning right now. And they're like, oh, all right, I'll talk to you tomorrow. So that's how they know I'm in the zone, and that's what I do.
DJ Byron Jasper. Yes, on the ones and twos. Okay, Dr. Kendall, what do you do in 60 seconds?
Did you? I didn't hear you, Francine. If that was to me, could you repeat that, please?
Are you on the ones and twos too? What do you do?
No. I would like to think that I'm on the ones and twos. I'm a music lover, right? I come from a music family. My dad tried to put me and my brothers in a band a long time ago. Didn't work well. I would go to guitar lessons before my football games, and my teacher would tell my dad he was wasting his money because I was too busy thinking about throwing touchdown passes or catching an interception and playing the guitar. So we crashed and burned a little bit on that. I did want to say this though, getting back to resources, every state has a licensing board for whatever professional, whatever discipline, professional counselors, social workers, psychologists, MDs, and also most of them have national associations of Black, medical doctors, social workers, professional counselors, psychologists. So that's an excellent resource if you're looking for someone who's competent culturally or someone who looks like you to be able to seek treatment. So that's also an excellent resource. And I'd be remiss if I didn't state that. But I'm a music guy too, and I'm a former athlete. So, basketball is still a hollow ground for me. You would think that it looks stressful because I'm on the sideline now. I coach. I'm on the sideline probably, going crazy, as my kids would like to say, but it's very relaxing and refreshing for me.
Get it out, right?
Absolutely. Yeah. You have to. And I'm definitely a get on the line coach. For anybody that's an athlete, I'm gonna yell to my kids, get on the line. They know what that means.
I love it. It's just been awesome having all 3 of you here. I wish we could go for another hour, but we can't. So I want to thank Dr. Samira Brown. I want to thank Dr. Byron Jasper and Dr. Kendall Jasper. We got to do some 23andMe, just find out if you're related. I want to thank you. Let's give it up for our docs. Okay, I hope everyone's doing okay. Thank you for dropping your information into the chat. We've got another video that we want you to watch today because it's pretty amazing. And we're going to roll that for you. And definitely watch this commercial, think about it, and let's roll it in 5, 4, 3, 2, 1.
We all need a boost from time to time. Our family, our crew. And now there's a boost for each of us that also helps everyone we're close to, wherever we are. If you're 12 plus and vaccinated, your COVID booster makes your protection even stronger, including against Omicron. It's a new year with a stronger way to help us tackle COVID.
You know why I love these commercials? Because it puts us in a positive light, and that's where we should be in the first place. So I want to thank everyone, no matter where you are, for joining us today. There will be a survey that pops up on your screen before we leave today. Check your email because we're going to send you some information, some feedback. We want to know, should we have another one of these? Should Dr. Byron be on the ones and twos for that one? I don't know, but connect with us. StayWellCommunityHealthFairs.org. StayWellCommunityHealthFairs.org. Social media on Facebook, Instagram. I'm a lover of Instagram and Facebook. So thanks for watching on Facebook today. Stay Well Community Health Fairs. So, ladies and gentlemen, it has been my honor and pleasure meeting you. My name is Francine Marie, and we can do this. Okay, we can do this. And I think that's a wrap. I want to thank you for joining us. Have a wonderful evening. If you're not home, drive home safe. If you're already at home, night, night. And stay well, America. Doggone it. Thanks for joining us.